Welcome to this explainer on Sheehan Syndrome. It's a fascinating but super hidden postpartum condition. Let's dive in.
It's basically a profound medical irony. The exact cells working to give life, they suffer a catastrophic failure.
The story starts with your pituitary. It's that tiny master gland driving your body's entire endocrine system.
During pregnancy, this gland literally doubles in size, preparing the mother to nourish her newborn.
Why? Because lactotrophs are multiplying like crazy, suddenly demanding massive amounts of energy and oxygen.
There's a really delicate, complex vascular network supplying blood to both the anterior and posterior lobes. But here's the dangerous mismatch. Metabolic demand is absolutely soaring, yet the blood supply stays exactly the same.
So what happens to this overworked gland during a sudden postpartum complication? Why does it just fail?
Well, if a mother suffers severe blood loss during delivery, her blood pressure drops completely off a cliff. Those oxygen-starved lactotrophs are the first to go. They undergo ischemic necrosis, meaning the tissue literally dies.
Usually, the posterior lobe actually survives the crisis. It relies on its own, way more robust arterial supply. But this anterior damage sets off a hidden endocrine crisis, one that unfolds silently over decades.
The most common immediate sign? A galactorrhea. That's just a medical term for failing to produce breast milk.
In severe cases, multiple hormones just stop. We're talking about amenorrhea, adrenal insufficiency, and extreme fatigue.
If damage cascades to the posterior lobe, it can trigger extreme thirst and central diabetes insipidus. Over time, the body clears away that dead tissue, causing the once swollen gland to drastically shrink down. The result? An empty sella turcica. It's a striking void on brain scans where the gland basically vanished. To diagnose it, doctors rely on obstetric history, blood tests to confirm the deficits, and neuroimaging. Because dead pituitary tissue can't regenerate, these hormonal deficits, they are entirely permanent for the patient.
So, patients absolutely require meticulous, lifelong hormone replacement therapy just to replicate those lost hormones. Ultimately, Sheehan syndrome is a stark reminder of the incredibly delicate balance within the maternal endocrine system.
Which leads us wondering how many other routine postpartum symptoms hide a much deeper biological vulnerability.